All right. Are you ready on the other side? It looks like we're ready to start here. Hello?
Yeah, we're ready here. Thanks.
Okay, great. Then, ladies and gentlemen, as you're aware, in a statement we issued just a few hours ago, we mentioned that the Undersecretary General for Humanitarian Affairs and Emergency Relief Coordinator, Mark Lowcock, is in the Bahamas today, where he met with the Prime Minister. We're very fortunate that in the amount of time that he's had there, he's able to spare a little bit of time to talk to the press about his visit. So we'll turn the floor over to Mr. Lowcock, who's speaking to you from Nassau in the Bahamas, and then we'll take a few questions after that. Mr. Lowcock, the floor is yours. Hello? Are you there?
Hello, it's Mark speaking.
Great.
Can you hear me okay?
Oh, yeah, we can hear you fine. Great.
Okay, fine. So firstly, thank you very much, everybody, for joining. I'm glad to have a chance to say a few things about my talks here in the Bahamas today and answer your questions. So first, as you all know, this is a huge event. I mean, really a hurricane on an enormous scale on this nation. Nothing of this sort has been experienced at all by the Bahamas before. In particular, the islands of Abaco and Grand Bahama have suffered vast devastation, and some of your organisations have started to show the pictures of that through the flyovers. But it's clear there are probably of the order of 70,000 people who are in immediate need of life-saving assistance, both on Abaco and on Grand Bahama. The Prime Minister and his cabinet, who I met, set out for me what they thought the most immediate urgent needs are: water, food, shelter, accommodation, and so on. And the relief effort is gearing into action. As you know, it's only in the last day or so, really, that access has started to improve. And indeed, it's still very limited on both Abaco and on Grand Bahama. Really, on Abaco at the moment, it's only helicopters that can get through. There is an airport at the south of the island, which probably is usable, but unfortunately, the roads are all out of action between there and the main population centres. The UN, together with the National Emergency Management Agency, who we're working in support of, together with the Caribbean Development and Emergency Management Agency, has done overflight today to gather more data on through the aerial survey, and there'll be more data collection work tomorrow, and then hopefully very soon after that we'll be able to get teams on the ground. I have told the Prime Minister that I will be immediately releasing $1 million, $1 million Emergency Response Fund, to deal with exactly the set of priorities that he has identified. So in particular, water, food, shelter, accommodation, and medical services and medical supplies. And there are quite a lot of offers of assistance coming in. Of course, the Bahamas is a prosperous country, but much of the response is being led, managed, delivered, and paid for by the Bahamas themselves. But this is an event on such a scale, affecting, as I say, 20% of the population, that it is appropriate for the international community to take up the request of the Bahamas to step in and assist as well. The United States are obviously very closely engaged with that, with quite a lot of logistical and other support. The UK have a naval vessel, the Royal Fleet Auxiliary, Mount Bay in the area, doing helicopter runs and other providing other support. I think there are other logistical support systems from some other member states as well. So, I mean, those are the headlines, really, Fahad. Probably the most useful thing for me to do is answer people's questions.
Okay, thanks very much. I'll turn over the floor to people's questions. Everyone, please identify yourself to Mr. Lowcock, since he cannot see you. Valeria.
Thank you. Thank you, Undersecretary General. It's Valeria Robecco from ANSA News Agency, and on behalf of ANCA, we thank you for this conference. So my question is, what are the next step, the immediate step that the UN is going to take in the next days, and what are the biggest concern on the situation in Bahamas right now? Thank you.
Thank you very much. So the first thing is to get moving all that urgent life-saving assistance that I talked about. In parallel with that, the UN will be working with the government of the Bahamas and the regional organization, the Caribbean Disaster Emergency Management Agency, to do as comprehensive as possible a needs assessment. So we really understand where the most vulnerable people are and what their precise needs are. I think that meeting the life-saving emergency needs and so on is going to go on for a period. I think, unfortunately, it's likely that the death toll will be found to be higher than has been officially confirmed so far. The Prime Minister told me official confirmation so far of 8 people having lost their lives. But I think the general expectation is that in fact, as the assessment is done and more access is available, the death toll will turn out to be tragically really significantly higher than that. But in the meantime, there are lots of people who need urgent assistance so that the death toll doesn't increase any further. There will then be an essential process of resuming basic services, the power supply, the telecommunication system, the water system, getting public services going again. Many of the health facilities are out of action, as you know. So getting the health system up and running again, and then, in due course, getting the schools reopened. And then, of course, in the longer term, there is a massive reconstruction agenda. The scale of destruction of infrastructure is vast, and that goes to public infrastructure, roads and so on, but also for people's houses and homes. So those will be the phases of the sort of relief and recovery and reconstruction effort.
Okay, Edie?
Thank you very much, Undersecretary General Lowcock. It's Edith Lederer from the Associated Press. I have a few questions from our people on the ground there. Aside from food and shelter getting to people who need it immediately, what are your biggest concerns? How much need is there for food and water? And you mentioned Grand Bahama and the Abacos. Are those the main area, the most affected areas, and do some communities there still remain cut off and inaccessible?
Well, thanks, Edie, for the set of questions. So to try and take them in reverse order, yes, there are absolutely communities who are not accessible, whose position we don't have information on, and who we're keen to get to in support of the government who are leading this whole effort really as soon as possible, because the longer there isn't access, obviously the greater the risk of further loss of life. Yes, it is the Abacos and Grand Bahama. Grand Bahama population is something like 60,000 before this, and the Abaco something like 15 to 20,000. Some people did opt to leave before the hurricane hit, but I think it's fair to say that nobody forecast that the hurricane would be on this scale and as devastating. In particular, no one forecast that it would basically hover for a 24-hour period, doing its destructive damage over Grand Bahama, with surge after surge, wave of destruction after wave of destruction. That's very, very unusual. And so, the number of people who are in a position that neither they nor anyone else had any reason to predict they'd be in is much, much higher. The life-saving urgent needs are very much in the areas that I talked about and you touched on, food and water. Some people have medically evacuated. As you know, I think in Freeport, the hospital has essentially been put out of action, if I understand it. So some of the patients were evacuated by helicopter to other parts of the Bahamas, and re-establishing medical and health facilities will be, one of the early priorities as well. It's important also to, the government is very conscious of this, to ensure that people's safety and security are maintained and that law and order is maintained. And the Prime Minister reported to me that there would be additional deployment of the appropriate services to ensure that that can happen as well. So those are the main things in the short term that everybody is focused on.
All right. Maggie? Yeah, Maggie.
Sorry. Hi, Mr. Lowcock. It's Margaret Bashir with Voice of America. Mr. Lowcock, could you...
Hi, Margaret.
Hi. Could you give us a little more detail on the displacement? I mean, is it everyone from those two islands then, the way you were giving off the populations? I mean, just give us a little idea of the number of displaced and did you have pre-positioned supplies in the area? I know you tend to do that a lot ahead of major things when you can.
Yeah.
And then with the local relief also, could you just tell us, how are you going to be getting around once you do have to deliver these supplies? We've seen pictures of all the damage. Are there any local boats that are still undamaged that, you could kind of recruit people or hire people to help distribute? Thanks.
Right. So, yes, there are supplies in the region. The government, and I saw trucks and so on being loaded up to be put on either helicopters or boats in due course with food and basic supplies. So, things are on their way. Of course, there were some supplies available on the islands already, and the government are in discussion with the owners of the various supply chain supermarkets and so on to get access to those. And I think everybody's behaving in a very responsible way about that. But one of the very big challenges is this question of access. The harbour the main harbour in Abaco is basically not operable. So sea access is very, very limited. The World Food Programme are looking at innovative solutions to try and help solve that problem. Most of the airports on Abaco are not functioning either. So, and those that are a long way from the population centres, and the roads between the airport and the population centres are washed away or multiple blockages. So that's a real problem. So the best access at the moment is by helicopter, and more helicopter capability is being provided. In terms of displacement, it's not clear how many people are displaced and to where, really. The number of people at need is between the two islands is roughly 70,000, as I said. But exactly where everybody is can't fully be established without further survey work, and that is ongoing at the moment. There is concern that some whole communities' locations have been destroyed or underwater or washed away, and one of the uncertainties is exactly where the people who were previously living there are now, and how to reach them, and that's one of the sort of ongoing uncertainties. The UN had staff in the Bahamas before the hurricane struck, because the National Emergency Management Agency asked us and the Caribbean Disaster Emergency Management Agency to pre-position the right experts to do an immediate needs assessment. And so all the preparations, I think, that could have been done were done, but the hurricane was at a bigger scale and lasted longer than anyone could have forecast, really, and left in its wake these tremendous difficulties of access in particular.
All right. James?
James Bays from Al Jazeera. Under-Secretary General, you answered a lot of the specifics. If I can ask you a big picture question, you spent your career dealing with humanitarian disasters. You are the world's top humanitarian official. Could you give us your personal and professional assessment of how bad this is?
Well, thanks, James. I mean, it's very unusual for 20% of the population of a country to be very severely impacted by a single event like this. I mean, if you put it in terms so you and I will understand, if that was happening in the UK, it would mean that 10 or 12 million people were very severely affected. So for the Bahamas, this is a huge event. In my, the most comparable thing I can remember in the recent era was when those hurricanes flew through the Caribbean at this time of year in 2017, and Dominica, population of 70,000 people, was completely laid waste. I mean, everything basically was destroyed, and almost everybody in the island was affected by it. The Bahamas has certainly never seen anything on this scale in the whole of human history, and so it's a huge event for the Bahamas. It's true that the numbers of people, given the overall scale of emergencies we deal with around the world, is not as big as in some other places, but a disaster of such epic proportions on a single country in a single incident is very, very unusual.
Okay, Pam?
Undersecretary General, thank you very much. It's Pamela Falk from CBS News. Thank you for the briefing. My question follows on some of the previous, how do you intend to get food into areas and water into areas that are inaccessible? The WFP mentioned drones, but it sounded like it was more for assessment than for actual delivery of goods. There are some private individuals, like a famous chef, delivering food. How soon do you think the food and water, the Red Cross said 62,000 people need water. How soon do you think that will get into the island, and how desperate a need is it? Thank you.
Well, it needs to happen as soon as possible, obviously. The basic get it there, and that speaks to the issues I've been sort of talking about. Sea access to Abaco is very, very limited. It's only to the main ports and harbours. The main transport system available at the moment is helicopter. Of course, you don't want to be reliant too long for helicopters to deliver food and water to such large numbers of people. So as soon as the airports can get up and running, and we can get going on trying to help the government restore the road access, and as soon as more sea access is possible, and WFP are working on potential solutions to sea access at the moment, and hopefully they'll come up with some good things very, very quickly. Those are the best approaches. And water, of course, part of the option is purification of available water on the island, and that's one of the things that can be looked at, as well as, if essential, simply delivery of water for people, while to buy time for more sustainable solutions to be put in place. So those are things that are being worked on at the moment. It's going to evolve from day to day, and there's growing capacity to support the government's efforts to make progress in dealing with all of these challenges.
Maria?
Thank you, Mr. Lowcock. It's Maria Hrenova from TASS News Agency. So I heard something about money which you specified in the beginning of your speech, but I didn't hear it correctly. So I just wanted to make sure how much money United Nations will be able to provide to help the Bahamian Islands, and how much money will be needed in future, probably if UN will be needed to raise more money for help. Thank you.
Okay, well, from the Central Emergency Response Fund, which I manage, I've made an immediate allocation of $1 million. That goes alongside other resources various human agencies have freed up. Basically, the purpose is to pump prime the initial phase of the UN response. The government of the Bahamas, of course, have their own resources and are allocating and spending their own resources to meet the needs of the population. They also had an insurance policy taken out under the Caribbean Regional Catastrophic Insurance Policy, which Ron has contributed to. And so my understanding is they will be due a payment very soon from that, which will help finance a lot of the immediate response as well. In the case of Dominica, when Dominica was hit by the hurricane in 2017, a payout was made within a period of a few days. And in terms of the total economic cost or impact of this disaster, it's going to, I do think it's going to run into billions of dollars, but exactly how much, it's really premature to say. And exactly what the cost of the immediate phase of the relief operation will be, again, it's too early to say. It's about 70,000 people. A lot depends on how quickly basic services and livelihoods can be restored and people can support themselves again. In the meantime, there will be quite a lot of people who will need assistance from their government and the international community. But it's difficult to put precise numbers on it at this stage.
All right. Evie?
Thank you, Mr. Lowcock. It's Edie Letter again. A couple of follow-ups. When do you expect this assessment mission to basically get a clearer picture of exactly what the needs are? And the Secretary General today already said that he was urging donors to be generous when there is a formal appeal. How long do you think that will take? And wouldn't it be better to open some kind of a fund now while this story is in the headlines?
Yeah. If that's the case, I think I'll have to make this the last question because I've got some other things I need to move on to do. But this question, so the aerial survey work was done again today. That's part of the way of building up the picture. There's going to be further survey work of a variety of sorts tomorrow, and then we hope very imminently, basically, we'll have teams on the ground. So my expectation is that the first cut of an assessment of the total needs and the numbers of people and where they are and so on will be available in the next few days. That's certainly what the government is. On resources, I do think you're right, Edie, that this has caught the world's imagination and now is a good time to mobilise support. And there is a lot of support coming forward, including from the private sector and voluntary organisations. I know the Red Cross have allocated money and have got an appeal open. And as I said earlier, of course, the Bahamas itself has its own resources and is using its own resources. But it's difficult, as I said, to put a precise number on what will be needed at this stage. But it's clearly going to run into millions of dollars. I think it's very good that neighbouring countries and countries like the UK are already responding. And when we have the needs assessment, it'll be, in a few days' time, it'll be easier to identify the wider needs and the cost of those needs.
Okay, if there's a...
So thank you very much, everybody.
Do you have time for one quick follow-up? What UN agencies might be involved? Do you anticipate? UNICEF, WHO, who else?
Yes, okay. And I am going to have to run. But there at the moment is the World Food Programme, the staff of my own office, the regional office of the World Health Organization, which is the Pan-American Health Organization. I think the International Organization of Migration, which has a lot of expertise in shelter and accommodation, are around as well. And there will be others too. The UNICEF, for example, are on the island now, in Nassau now, and will be available. Others are looking at exactly what is needed and who will go when. I will be in touch with the heads of all the relevant agencies later today to brief what I've found and to coordinate with them who is going to deploy what capacity when. So we will, as I undertook the Prime Minister, make available all the capabilities needed on the UN, both for the immediate phase and also some of the longer-term issues, which I discussed with him as well, planning the reconstruction, dealing with the debris management issue, all of those longer-term, the power system. They're very, very worried about how to re-establish power supply in Abaco in particular. And the US will make available its capacity and expertise in all those areas that the government particularly asked us for support with. So it will bring in a lot of different UN agencies and their capabilities. So thanks again, everybody. Look forward to seeing you again face-to-face soon. Thank you very much.
Thanks a lot. Thanks very much.